The Rural Physicians Award program was established to pay tribute to the achievements of physicians who live and work in rural Alberta. This year, we honor Dr. David Miller for his outstanding contribution to his profession and his community.
I feel it reflects Dave's contribution to rural medicine over the last 30 years.
He's been an outstanding proponent for medicine in our community.
Commitment to his community, but also to the wider Alberta and group of colleagues in the province.
There hasn't been anything that's really happened in our community that he hasn't been involved with in the medical sense.
And his kindness with his patients. They just love him. They all love him. It's from the little ones to the older people. They always depend on Dr. Miller.
I did think he was like a teddy bear, but from then on he's been a leprechaun. So
I certainly was extremely surprised. I wasn't aware that this was even going to happen to me. I phoned up David Kay, and he said, all of a sudden he said, "Congratulations." I thought I was going to be nominated for another committee.
You know, he's being recognized for all the things that he takes, you know, he just does.
Probably hard in family life that he did it. But, you know, he's a giver and he's a goer. And if he believes in something, he kind of pursues it.
He doesn't think he's doing anything special.
I like him as a teacher. He's very patient, very understanding, quite willing to make the necessary corrections, but always in a friendly and diplomatic manner.
Oh, he's a wonderful man, a wonderful doctor, that's for sure.
One end, the other end. How's the foot doing after the bunion next to me?
It's good. We're so fortunate here to have the hospital, and he's worked hard for it.
now maybe we can get down to serious business. I think she'd like something from way back when. The function is the 14th, and that's not much more than 2 weeks, is it? And we should have some pictures, actually, of some of the Christmas parties. Oh, but those are censored. Oh. Grief. They are. Yeah. Oh, dear. Anyway.
We appreciate him very much because he did an awful lot for all of Beaverlodge to try and keep our hospital, because at the time there was talking of closing our hospital, and of course we all got up in arms. But he fought a good fight, together with the other 3 doctors, I must say, because we got 4 wonderful people to look after us.
If we would have lost our hospital in the community, it would have been devastating for the community.
He's just able to be a good common denominator. When there's problems in the community, he comes up with good answers.
Okay, Colin, let's go. Whoa, I like it. You're not a doctor unless you play golf. That is actually part of the curriculum. Huh? Isn't that right?
Yeah, I think probably one of the biggest things I learned from Dr. Miller is the potential for making relationships with patients, you know, like, I mean, I think you can address why they're coming in and their illnesses and that sort of thing, but he sort of has that unique connection with them before they come in, and because he's a very warm and personable, sort of jovial type of guy, they sort of have that immediate connection when they come through the door.
He's been our doctor for...
Oh, I guess 20 years.
Oh, no, it's
more longer than that. I don't...
He is 32.
Yeah.
Breaks down a lot of barriers, I think, especially when patients have difficult things to talk about. You know.
Here, in a rural hospital, they know your condition, they know you personally. If you're critical, you're moved right in.
Yeah,
I mean,
there's no waiting around.
There are times when you're frustrated with any doctor. I don't care how, you know, you want them to be a miracle worker, and it doesn't always work.
It's a great privilege, you know, people come to you and say help. And it's hard to sort of not get involved in them. And some of the things they have would break your heart. So I see you got your back scratcher.
Yes.
Yeah, this blinking jaundice makes you really, really itchy. So
everybody's got to have one.
So let me show me how you use this. Where's the scratching?
You just go down inside your shirt and you just start walking.
That's it. That's good. Huh? You mean you don't actually let poor old Lil scratch your back?
I do, but I'm much more gentle than he is.
No, you're not.
Okay. They go through terrible suffering, and sometimes the outcome is not good, and sometimes I can't help. I mean, the least I can sit and listen to them and try and help them through it. And I certainly don't think I can help everybody, but I mean, the least I can do is listen to them and be a friend to them. I don't know, that's just me. I know, you're different for punishment.
Yes.
Huh?
Yes,
you should take something, don't be afraid. That's what it's for, okay?
Yeah, I know, but I hate them doggone drugs with a passion.
I know. Well,
Okay.
okay?
Yeah.
Okay, you'll be on your way.
You betcha.
Okay.
Thank you.
I'll give you back this.
Oh, okay. I thought you were going to try and scoff that off.
Yeah, okay.
I'll have to find you one of them.
Okay. You love to hear that bobble, 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 bobble. The chi-chi. Yes, sir. Just do the rural doc thing.
Dr. Miller and his wife Irene lost a son when he was 10 years old.
When my brother died, I saw he was amazing strength. Actually, my parents, it was amazing. And from that, I think you can look and watch and see how they deal with certain situations and certainly learn from that.
The town rallied around his family and they were very supportive, yes. And it was nice to see that reaction come from everybody.
Maybe his faith got stronger. Certainly, I mean, he's always been a compassionate person, but you don't realize how important family is to you until you have somebody go. And it was amazing how strong my parents were. And we miss them every day, but Dad actually took something that was very negative, and instead of blaming people and, you know, that kind of thing, he tried to take the best of it.
So Colin, actually this is a little fountain we gave to the course in memory of Dave. Yeah. Okay, Dave, God bless you.
A lot of people take family for granted, and I think it's really important, and so does our family.
Serve the Lord with gladness, and come before his presence with a song. For we are a part of the family. Come in and sit down. You are a part of the family. We are lost and we are found, and we are a part of the family.
Lots of times we've had the kids all parked ready to go to the lake or the river or something. I say, sorry kids, somebody's come in here and they're in labor, and they all pile out. So I'd also like to thank my kids, because they've been a big support here too. This isn't doctoring time, this is pleasure time with the son-in-law. I came to Canada on the 31st of October 1970, 10 days after I got married. I don't think I'd recommend that to anybody. 10 days after your marriage to go leave home, no job, $500, and hope that we make it.
Actually, it was the people of Beaverlodge that they were alive, they were fun, and we thought we'd stay another few weeks extra. And then 6 months later, we were still here. We bought a house, and 33 years later, we're still here.
A person here who that I need to recognize is my wife. I wouldn't be able to do this at all without her support, because that's absolutely linchpin.
Dave and John and Paul and finally myself, we work at cooperating to support each other, and that's what we think is the secret to rural practice, is the effort made to look at each other's interests as well as our own. But also the other colleagues, like everybody has come to this with a spirit of cooperation, and that is what I think makes us a successful group.
With the four of us, we cover universally, cover every minute of every hour of every day, of every week, of every month, of every year, the four of us. So we have to have a cooperative, collegiate relationship to do that.
Without them, I couldn't exist. We absolutely need each other. There's no way that I can exist without them.
You know, as the family physician or a rural physician, people tend to have you on a bit of a pedestal, and if you make an idiot of yourself at least once a year, it gives you a little bit more credibility.
Okay, you give us the start.
In Dublin's fair city, where the girls are so pretty, I first set my eyes on sweet Molly Malone, as she wheeled her wheelbarrow through the streets broad and narrow, crying cockles and mussels, alive, alive, oh. Everybody. Alive, alive, oh.
Love of life. Joie de vivre. Yeah, he does, in spite of all of the hardships that we occasionally face in practice. He always maintains a positive, happy, joyful element of living.
But I think it's a really noble profession. We try our best, but sure, we don't know anything. Sometimes we're too arrogant, and sometimes we don't listen to people. But basically, most doctors who survive, who want to keep going, have a heart to try and help people. Otherwise, I don't think you'd be in it. You wouldn't be in it for any other reason, really, than try and help people.
I think it's a true vocation for him, and I really think he's perfect for the job and the award.